case for no confidence. YSU Academic Senate, October 6, 2021. On October 6th, I will be asking the Academic Senate to join me in a vote of no confidence in the administrative processes currently in place to deal with the COVID-19 pandemic. Although in this presentation, I'm going to give you my reasons, and I will note the actions of specific individuals and the statements of specific individuals, I am actually unclear as to ultimately who is responsible for the policies, procedures, and protections, or lack thereof, as I will argue, that have been acted at YSU. So given there's no one person I can point to, I'm asking for a no confidence vote in the entire academic or the entire administrative process. And is this clear lack of leadership, combined with what I can only characterize as blatant lies to faculty, staff, students, and the community at large, which compels me to call for this vote? To understand why I think a vote of no confidence in the administrative processes that have surrounded COVID-19 is necessary, or is at least justified, I think it's important to understand the timeline of events and to see how that timeline shows just how, in my opinion, the university has behaved poorly towards faculty, staff, and students here at YSU. So I want to begin with June 28th. This was when the initial purchase order for air filter upgrades. So we've heard on a number of occasions about the increased air filtration that's going on at YSU. And so an initial purchase order was put in on June 28th. So this was several months, obviously, before the beginning of classes, giving the university time to upgrade those filtration systems. What we now know is at this point, with the intent to upgrade the air filtration systems, that there was not at this time any intention on the part of the administration to mandate testing, masks, physical distancing, or vaccination. So I have a quote here from an email from Julie Gentile responding to Ryan Tekak from the Health Commission of Mahoning County, and they said at this time on August 5th that YSU is not mandating any of those things. So it was the university's intention, at least this is what was stated publicly, that we are not going to put any of these protections in place in the fall. And there was an order, apparently a purchase order on the 28th, that was set to bring in these new air filtration systems and filters. What we know from documents released is that the actual processing of that purchase order didn't take place until August 6th. So purchase order for Ketchum Walton for the majority of the MERV 14A, 15 air filters for campus buildings is processed less than a month before classes are to begin and 39 days after the initial request. Now, at the time that this was put in, and I think it's important to note the date on August 6th, that the estimated deliveries of these filters would be September 30th, 1 month after the start of class. And this doesn't include the estimated installation time across campus of 2 to 3 weeks. So on the 5th, we have no intention, says Julie Gentile, talking to the Mahoning County Public Health, of putting any safeguards in place. And yet the very purchase order that was necessary to get the filtration systems that are supposed to be sufficient to protect us wasn't even processed until the next day, until the 6th. Now, at the time I'm talking about, just to give some sort of background, the day before, Provost Smith and Julie Gentile are to appear on WFMJ to make statements about what's going on at YSU. Delta variant cases are on the rise in Ohio. So at this point, we're up to approximately 2,300 cases in Ohio. So it is higher than we had seen in previous weeks, but still below what we're at actually right now. On August 8th, the very next day, the reporter states here, as I've quoted, University Provost Brian Smith and Director of Environmental and Occupational Safety Julie Gentile said on WFMJ Weekend Today they're taking proper measures such as updating air filtration systems and do not feel the mask mandate is necessary at this point. And again, I quote, we are continuing to evaluate case numbers as well as hospitalizations, Gentile said, with those pretty low hospitalization numbers at this point, and working with our local health department, YSU thinks and feels pretty confidently that the testing and indoor air quality we're supplying to faculty, students, and staff, we have a pretty good plan in place, but at any point things could change and we're ready for it. So acknowledging we have a plan in place. Well, at this point, this is 2 days after the filters were actually, the PO was actually processed. And we know that those filters aren't going to be in place at this point. What does Gentile say to the public on WFMJ? We have upgraded our air systems substantially. Now, these statements were made after the new filters had been ordered. They weren't even on campus yet, and no upgrades had been made. So at best, these statements were deceptive. At worst, they're outright lies. I don't know how any other way of sort of parsing these statements. Right? We're going on and talking to people, faculty, staff, students, the general public who are looking and saying, what is YSU doing? And YSU is claiming that they have substantially upgraded their air systems. This is on August 8th, that they already knew that those filters weren't going to be here. Faculty announced a protest after this. Faculty announced a protest about the mask mandate, that we're not going to require masks. Within those very few days, we're now at 3,300 cases. So again, Delta is beginning to surge. We're seeing these increases. The faculty announced this. YSU is preparing to meet with local officials, they said at the interview in WFMJ that we are in constant contact, or we are in contact with local health officials. On August 11th, after the faculty announcement, we also have an email. This is from Shannon Tyrone to Julie Gentile. It concerns me, and I quote, "It concerns me that we say YSU will work directly with local public health officials to determine what guidelines are appropriate to implement within the context of our local community. It concerns her that they're going to say YSU is going to work with these people. Why? When we will not be doing so. They are going to tell us to put mask required plan in place, to put a mask required plan in place." So on the day that the faculty announced a protest about no mask, and also at a time when YSU is planning to meet with health officials, 2 days before that meeting, they've already decided that they're not going to follow the guidelines and the guidance of those health officials. 2 days later, on August 13th, the administration meets with Youngstown Health Department. Union is denied access to that meeting. So there wasn't faculty representation there. No report has been provided as to what was discussed at the meeting, what were the positions of the various parties at the meeting. And we know at this point, in fact, prior to this meeting, publicly, both the CDC and Youngstown City Health Department were recommending masks indoors for all people, regardless of vaccination status. That was before this meeting even took place. So YSU walked into a meeting knowing the following: the filtration system wouldn't be upgraded in time for classes to begin. The policy at that point was still not to mandate masks or testing or vaccination. And they walked into a meeting with health professionals with the idea that they're not going to listen to them anyway. So we don't want to make public statements, they're saying, that say we are. So YSU eventually caves on the mask mandate. No mention is made at this point that the air filtration system has not been upgraded. So masks are now mandated, but we're still silent. As far as anyone knows, the statements made before is that we have already upgraded our air filtration systems. No mention is made that they won't be upgraded on time by the time classes begin. And no social distancing plans for the classroom. So at this point, all we've gotten was a mask to cover our face. There's nothing else. Testing, distancing, and they've left us uninformed. They've left us, they've left students, they've left staff uninformed that the systems hadn't been upgraded. So what indoor air quality is YSU providing? Again, with no notice to the faculty when asked, John Hayden, Director of Facilities, sent this. This is something that has come out since the 26th, but was actually presented to the union prior to this. The MERV filters that are currently in use on campus are MERV 7 or 8. YSU has ordered MERV 14A and 15 filters, but due to supply chain issues, they have not yet arrived. The UVC light emitters have been ordered that attempt to kill viruses. These also haven't arrived and are not installed. They're looking into bipolar ionization, but that must be engineered. Ventilation will not be turned off as we are not participating in energy curtailment. So basically YSU agreed to masks and turn fans on for us. Again, not telling us that these systems hadn't been upgraded, and initially hadn't even planned to tell us that they hadn't been upgraded, nor were they planning on actually requiring masks of our students. So allowing those of us who might have children at home or people that are immunocompromised, or perhaps just people who don't want to carry the virus to other people, regardless of whether they're family members, feel that we don't want to be complicit in causing someone else to become sick. So here again, the UVC air filters, excuse me, purchase order for JCI to furnish and install UVC lighting in Williamson Hall air handlers to enhance air qualities. This was actually processed 2 days before classes started. So nowhere near completion, nowhere near being installed. Again, as we've been told over and over, emails had been sent out. Department chairs had forwarded emails about the systems and the upgrade to our air filtration and our contact tracing, and we're going to have surface testing and all these things that we're going to be doing, except the biggest part of that, the one that supposedly the most important part, was not actually done. First day of classes. What happened on the first day? Classes resume at YSU. Again, no social distancing. All classes are back to pre-pandemic size. There's no mask provided to faculty, which one of the things that we were told would happen. N95 masks require medical authorization, which was again held up for those who had medical requirements of masking. Turns out those masks were never distributed because of the lack of a checkbox on the application form that told them that you didn't have a number of conditions. There were no cleaning supplies, as far as I know. There have none been added to the classrooms. No ventilation system upgrades, aside from, again, turning the fans on. And no announcement to the faculty that this hadn't been done. No standard procedures are put in place to deal with students that refuse to comply with the mask requirement. Again, college by college, dean by dean, how do you deal with a situation where a student fails to comply? Do we call the police? Do we call the chair? Do we send them to the dean of students? Where is this? Is there a standard procedure for all of this? And is there enforcement outside of the classroom? So in non-eating areas where students are gathered, where masks are down around their nose, taken off completely, who is it that's responsible to make sure that students are abiding by the policy that the university has put in place? None of this by the first day of classes was clear. And subsequent meetings after that first day didn't actually clear up much either. So the second day of classes, we are now at 5,900 on August 31st. So again, starting with somewhere around 2,300 by the time the second day of classes arrive, we're at 5,900 cases in Ohio, and they continue to rise. So what do we have as of the 29th? And just after, Ohio's been averaging about 6,400 cases per day for the last 21 days. Daily case numbers have gone as high as 9,000 since class started. And in Mahoning County, we know that 47.88% of the population are fully vaccinated. Only 47%. And it's around 35% for people under 40. Again, this was information taken from the Vindicator, if anyone would like the reference and the article. This was information that was publicly available. So these are some of the indicators as of the 29th. The 30th, 4 weeks into the fall semester, we're now September 30th. We're still struggling to distribute masks. It's only been a few days since faculty have received masks in their mailbox. In some cases, faculty still are waiting. YSU has not included faculty in any further COVID safety discussions. YSU is relying on self-reporting of positive COVID tests and not actively testing students. So it's not engaging in the active testing that we see at schools such as Cleveland State and Ohio University, which are actually having students come in, take tests so that they can get an accurate sampling of how many people are exposed or infected with the virus. YSU also has apparently made a decision on vaccine mandates after asking at the first academic senate meeting what our views were, and said that they would be looking into this and talking with other stakeholders at the university. A press announcement was released by Ron Call saying YSU has an indoor mask mandate but says they're not mandating vaccines. Does that mean never at this point? I don't know, but it's unclear. We also know that hospitalizations among those under 40 and children has hit pandemic highs in the last few weeks. And again, this is also from Vindy.com, which has reported these health numbers. So the issue I have with the way in which our COVID policies have been put in place is that, in one sense, we have been deceived. There's no way for me to say it other than we've been deceived. We've been lied to about what the university has done. And it also seems that several people in charge felt that no safeguards were necessary when school started. Had it not been for the protests, had it not been for that, it seems that we would have gone in on the first day of class with no upgrades to ventilation, no social distancing, no mandatory masking, no vaccination requirement. In fact, we don't even ask students if they are vaccinated. We haven't even asked to check how many of our students are vaccinated. This, to me, is irresponsible, and it shows that I have lost all confidence in the ability of the university to ensure the safety of the faculty, staff, and students, not to mention the community at large and the community surrounding YSU.